I'm really delighted to be introducing Horst Merkle, Director at the Chief Technology Office of Roche Diabetes. And this, I hope, will be a very informative presentation for you all, as it will provide a snapshot of CGMs and also non-invasive measures of measuring glucose, and also looking at the role of machine learning and AI and some of the potentials and the challenges associated with this technology. So the presentation is around 20 minutes. Uh, the floor is open for questions, so type in your questions on the side. Don't be shy. We'll ask all the questions live. And Horst, the stage is yours. 2 minutes before the end of your presentation, I will give you a heads up that time is almost up. So yeah, I will now disappear and you may start.
Here we go. As the introduction said, I will give you a quick overview what's going on in diabetes care. And we'll talk about what is in trend, what is new, what is coming, and with the associated hopes to make things better. But with hopes come also realities, which I will highlight as well. So here we go. A couple of basics maybe first. Diabetes monitoring, glucose monitoring is very, very important for everybody who has diabetes, the so-called people with diabetes or PWDs. If you run too high in your blood glucose, that leads to the well-known comorbidities that go along with many of the diabetic patients, mainly going back to nerve and vascular damage. And you see in the picture what comes along from the diabetic foot to retinopathy to nephropathy and everything in between, cardiovascular disease, stroke. If you go too low, it's more an acute risk, which can actually be fatal and is fatal in unfortunately many cases that are still reported. Certain symptoms are listed also on the picture. It starts with headache, nervousness, sweating, anxieties, can also be kind of trampling and these type of things. And as said, it can lead to a shock, a hypoglycemic shock, or which can be fatal. So today we know mainly two glucose monitoring technologies. One is called SMBG, or self-monitoring blood glucose monitoring, which is also called single strip monitoring, where you use strips. I list here 1 to 8 measurements per day. For some type 2 diabetics, it's actually sometimes even 2 to 3 times, just 2 to 3 times a week. The relatively new continuous glucose monitoring is measuring every 5 minutes a signal. And you see the comparison. The advantage of continuous monitoring is that it doesn't miss highs or lows in between finger stick measurements, as you can see there. It's a little bit exaggerated. Most patients, most people with diabetes using their finger stick method are very well attuned to when to measure. So yes, both things have their place. The vast majority of diabetics still use the finger stick methods. A couple of features in comparison. We hear very often that CGM is less invasive. In fact, it is not. The only difference is that insertion or pricking happens less frequently. In this case, the wear time of a CGM is between 7 and 10 days. So you prick yourself every 7 to 10 days only, whereas with single strip, you prick yourself 1 to 8 times a day. Another variation of CGM is implantable sensors, and the wear time is about somewhere between 90 and 180 days. However, you can see the picture in the lower right. These sensors are pretty big, and they need to be inserted under your skin via surgical procedure.